I'm Combat Craig, and today we're talking about the VA withholding medical evidence and how you can fight back. In order to establish service connection, you need three elements: diagnosis, symptoms, and a nexus. Today we're going to focus on the diagnosis because it's actually harder to spot than you may think. If you're interested in learning how to put yourself in the best position to level up your VA claim, I'd sign up for my boot camp at combatcraig.com. Get in there. So how can the Department of Veterans Affairs treat you for a disability and not give you a diagnosis? Seems ludicrous, right? This is a good question, and the answer is the VA's the enemy, and they can do whatever they want. You have to review your medical records to make sure you have a diagnosis. It's going to look differently in your records than it is for mine, but you need to make sure that you find it in there because that is one element of service connection. You have to have a diagnosis. You can have something that will be almost like a diagnosis, or will this work good enough for a diagnosis? It needs to be a diagnosis. So you do that by reviewing your medical records. And I'm going to walk you through my medical records and show you where I finally found my diagnosis of combat PTSD, what I did to actually clean it up and make it real clear, because it still wasn't clear to me. So I went out and got a private doctor to clarify things up. So I have my little blue mouse thing here so you can see it. This first snippet is from 2005. So screen for PTSD. This is 2005, what, 17 years ago or something like that. And, you know, do you have nightmares? Yes, yes, yes. Like, yes to all these. Extremely bad. PTSD score 60. Patient meets criteria for PTSD. Referred to MD. I don't even remember this. This is in 2005. But this is an example of not a diagnosis. There's mentions. They're saying that I meet the criteria, but this is not a diagnosis. Fast forward to 2015. Here is a CNP exam for mental health that I had. So we have, these are the notes from the CNP examiner. So exit exam dated 8/91, unremarkable for mental health issues. Yeah, no shit. You don't talk about mental health issues. I don't even think PTSD was a thing in 1991, but this is one of the things they're going to put in your records to deny you. You know, health record dated 6/23/89, cleared for deployment to Panama. So he was healthy as a horse there. Entrance exam, 11/24/87, unremarkable for mental health issues. So they're going to go through and find the places where, well, no mental health issues when he, you know, got in and he was cleared for a deployment and he was fine then. And then when he got out, he was fine. Everything's fine. He's been on medications for anxiety and depression. And he also states that he hasn't been right since Desert Storm. I made a video a couple days ago about how the VA will quote you. I haven't been right since Desert Storm. So watch what you say to all VA doctors, VHA doctors, VBA, CNP examiners, all of them, because they write all this stuff down and they quote you. So it's just kind of funny. There's no problems. But then the war started and he went downhill real quick and we kicked him out. So they like highlight that, but that wasn't used in my favor. I was able to do that afterwards a couple of years ago and get that fixed. And then here's the evidence they were using. There's a screen for alcohol and depression and PTSD in 2005. 2008, did some other stuff, nursing notes. I was saying stuff, I just didn't know how to say it, and I needed to get a diagnosis is the point I'm trying to say here. I could have had this claim won and established in either 2005 or 2008, but I didn't get combat PTSD established until 2019. So then they kind of repeated stuff, and this is what they write. The claim condition was less likely than not, less than a 50% probability, incurred in or caused by the claimed injury, event, or illness. And then they provide rationale. So when it's less likely than not, that means your claim's tanked. So now in 2019, I'm looking through my records. I see there's PTSD right there. There's a SCT code, mood disorders, on my problem list. And this is the first time that I see a diagnosis. It's not a big glaring unicorn, but it's in here. Diagnosis, primary, focus of treatment, insomnia, secondary, if applicable, PTSD. So I'm kind of looking at that going, that's kind of a diagnosis. It'd be nice to see more, so keep scrolling through your records, VHA records, private records. Here's my past medical history. There's no mentions of PTSD here at all. They're very clever about keeping your diagnosis out of things you're going to file a claim for. So here's some notes from the VA psychiatrist. She did diagnose me with PTSD, and then she says, will increase the dose of duloxetine to 30 milligrams for further relief of PTSD. So there's a diagnosis of PTSD and then prescribing meds for further relief of PTSD. So those two things are looking pretty good. They're looking like a diagnosis to me, but I'm not a doctor and stuff. And we're talking about opioid use and Adderall, and they don't like Adderall. They don't like Xanax, and it's causing mood instability, but he's not willing to get off of it, but I was getting off of the Norco. I'm not sure the bupropion helps, which is Wellbutrin. Will increase the dose for further relief of PTSD. Reports of numbness on his left hand. I never reported numbness on my left hand because it's on my right hand. This is an example of an error. This wouldn't help me if I was filing a claim for my right hand, which I'm not, but this is why you go through and look. You guys, I'm trying to build a claim here and build medical evidence for my right hand, and you got it in my left hand. This is why you want to patrol health records and download them after you go see the doctor to make sure if there's an error, you can get it corrected immediately, because this is 3 years after the fact now. So I thought I had a diagnosis of PTSD. It looked like it. The doctor said she was treating me for it. It was listed under diagnosis, but I still wasn't clear, and I was working on a 70% mental health rating. So I went to a private doctor and had him fill this out, and then it gets real clear. Current diagnosis, mental health disorder 1, PTSD combat, right? Mental health disorder 2, somatic symptom disorder. Mental health number 3, unspecified anxiety disorder. And then this one is, I was already service connected for these ones, but these are the two new ones, PTSD combat and somatic symptom disorder. And I was trying to get to 70%. So you don't necessarily need to have 5 diagnoses to get this. You just need the levels of social and occupational impairment. And that's what this DBQ goes on to do. So this is what I did. I couldn't quite see it. I didn't see it for decades. And then once I saw it, I wasn't confident enough in that actually being a diagnosis. So I went and got a private doctor. So there was multiple diagnoses, or at least one, if that makes sense. If you enjoy learning about how the VA really treats veterans, then smash that like button and consider subscribing to my channel so you don't miss any of my future videos. One of the tricks the VA loves to pull on us is the old lack of diagnosis trick. If you're in this position and you think that an accredited VA disability lawyer might be good for your claim, I check out Hill and Potten at hillandpotten.com. Make sure you understand the rules of the game before you start playing the game. The VA is the enemy. That's rule number 1. And I teach you all about the game as it applies to VA claims in my boot camp at combatcraig.com. The primary element that I see most veterans losing on is the nexus, or the link between the disability you're filing a claim for and your active duty service. Check out this video right here that I did about nexus letters so you can learn about nexus letters and a diagnosis, and we'll talk about symptoms in an upcoming video.